Hey, it's Dr. DeCubellis here. I am joined with Dr. Gibbs. Thank you for stopping by.
Thank you.
No problem. And the reason that I wanted to have her stop by and I wanted to talk with everyone is we wanted to discuss something that's really important, and that's sleep apnea. It's something that a lot of people are dealing with, and unfortunately a lot of people are dealing with it and they don't know that they're dealing with it, but they have all of the signs and symptoms of it. So I want to have you by, let's discuss this a little bit so people know not only what to look for, but what they can do about it.
Yeah.
So tell me, in your office, what are some of the signs that you see if you don't hear anything else, but you just look inside, you can look in their mouth? What do you see of someone who has sleep issues and sleep apnea?
So a lot of times what you'll see a smaller airway. The size of their jaw might be smaller. It might be further back. You'll see a larger tongue size. And you might see a lot of broken fillings, crowns, teeth as they struggle to breathe at night. So there's a lot of things you can clinically see.
And now with that, what it means is not only are they struggling to actually get the air while they're sleeping, but it's causing physical damage to their teeth potentially, correct?
Yeah, exactly, yeah.
So we've got a widespread thing. When we talk about sleep apnea too, most people think about snoring, which is definitely a big thing, but it really has to do with anything about getting the right amount of airflow. And the reason that's important is when we don't get the right amount of airflow, we can't get the proper amount of sleep. We can't get into that deep sleep, which really is going to affect healing. But what I think people don't really realize is that when we talk about healing, it's not just like healing from a cut on your leg. We've got, let's say they had a dental procedure and then they've got issues with sleep apnea. They're not going to be able to heal properly from that, so they're not going to get the best results, correct?
Correct. Yeah, you're exactly right.
So now let me ask you, when it comes to the actual sleep apnea, trying to get more oxygen in, what are some of the options that people have that you're able to use with them?
So you can expand someone's airway up to a certain amount of time. That usually involves devices that are in to expand, think braces, expanders. But one of the easiest ways is just repositioning the jaw. So moving your lower jaw forward, opening up the jaw just a little bit. And what that does is it moves your tongue a little bit out of the way and it opens up your whole airway.
And that's what's important. And the nice thing about that is it can be, obviously it's custom made, but we have different options that people can get depending on what they'll actually use, which is always the most important thing.
Of course, yeah. The worst device is one that you buy, you get fitted for, and it sits on the side of the bed. So you have to find something that is a custom fit for every person. So there's a long list of devices. So when finding something that's perfect for a patient, you go through all the different things, you pick a device, and then with every device there's ways to even custom fit that device to find the perfect thing for someone.
And the biggest thing too that I think people don't understand is that the only option is not just a CPAP.
No.
That is an option, but there are other options as well. Because I know when people think about CPAP, they think about this huge machine attached to their face, and it looks like they're in one of those things out of Star Wars, and it's uncomfortable. And if it works for you, that's great, but if it doesn't work, there are other options as well.
Oh, absolutely. Sleep is such a multidisciplinary approach. You have physical therapy, just the dental, medical side. It's something that not one field can treat it. You have to have an approach from all different sides because it's not just the mouth, it's the whole individual.
Yeah, and it's great that you brought that up, because one thing too is I can't remember one time where I found a patient with sleep apnea that was acute, meaning that it just started yesterday. It's usually been there for a while. We've got chronic issues, and the biggest thing is that when we have chronic issues, it means that the body has been changing to try to adapt to that issue. So not only can we have that with issues with obviously grinding of the teeth, but also with wearing away of things like you talked about, but the musculoskeletal system is going to try to do things to open up that airway as well. So we've got buildup of certain muscle fibers on one side versus the other. We've got potential changing of posture and movement patterns, altered muscle memory because of all these changes, and then that can lead to things like arthritis and degeneration as well. So the important thing is we have to look at everything as a whole, because even if we restore the airway, but there are these other issues that now have set in, they're still going to have issues. If we look at just the musculoskeletal system and we don't fix the airway, again, we're not going to be able to heal properly. So it really is about working together with everything.
Absolutely. Yeah, that's the best approach.
And one question too, I think a lot of people will have is that, how do they even know if they have sleep apnea? And there's a couple different ways that people can tell. Usually what I found is that the reason that they come in or even bring it up is usually they get a complaint from the spouse.
Yep, exactly.
Hearing them snore,
Yeah.
rolling, making noises when they're asleep, or waking up and eventually keeping the spouse awake. So that's a great way, which is why I always like to have the spouse's input, because we get more information.
Exactly. And you know what? It's crazy. A lot of people think that snoring is a right of life, that it's a normal thing. When you look at it, something as seemingly benign as snoring, it can cause calcifications, plaque formation, which can in turn just lead to something like a stroke. So you don't have to just stop breathing at night. It could just be snoring that signals that red flag to go get help. Tell your parents that they need help. Tell a friend that they need help. It's so easy to get tested and talk to someone. Just, you need to get help.
Yeah. And the thing with this too is that when it comes to treating issues with sleep, it's a very step-by-step approach. We don't just jump in and do something. We have to make sure, A, that they have the issue, we identify what the issue is, how severe it is, and then we can walk through the process that way. So if people have these issues and they want to get checked out, there is going to be a step-by-step approach. That way they get the right kind of treatment or fit or appliance that's going to work specifically for them.
Definitely. Yeah, sleep issues, it's not just sleep apnea. Sometimes it's movement disorders, insomnias. There's so many different ways that someone cannot sleep and not get oxygenated at night, but really reaching out's the first step.
Yeah, I definitely agree. I hope that answers everyone's questions, or at least gives you a little bit more insight onto sleep issues, sleep apnea, and those different things. If you have any questions, think that you might have it or a spouse has it, reach out to one of us. Our contact information is below. We like to work together to work on these things because we think the collaborative approach is obviously it's going to suit the patient the best.
Absolutely.
And we're here to treat you and give you the best kind of results that you possibly can get. So feel free to reach out. We'll answer any questions that you have and look forward to helping you in the future.
Thank you.